What a difference it makes to have attention paid to a patient. I've been hired to help people who've come home from the hospital suffering from strokes or heart attack or cancer and have more or less been neglected by their family, not perhaps intentionally, but because they don't know how to take care of them, don't know how to take care of patients. So after a few weeks, and especially after a few months, they start healing and they start getting strong enough to walk around. Sometimes they don't even have to use their cane anymore, although they probably should. And they begin to talk to you about their life, going back usually until I would say around 12 or so. Most people don't remember too much more than that, but there are some who remember everything. So after that, I talk to them. I take them down to the ocean and sit at the benches with them at the beach. And they tell me how happy they are to be back there again because nobody has taken them in a few years. And they begin to show youth again, which is funny. They begin to talk about when they were teenagers or the big disappointment in life or how their husband cheated on them, all kinds of things. The men aren't as conversive, of course. Women are far more conversive. But even they say odd things like, I'd marry you if you were a woman because you're taking care of them like their mom did, I suppose. As time goes by, though, you do have them deteriorate, especially if they're a hospice patient. And then you are unable to really get them into the shower on the chair. You can't get them into the wheelchair to get them into the bathroom. So you have to start doing all the work over dressing and the bathing in the bed, which makes it tough. And sometimes the wives aren't so pleased about that because you're doing a better job than perhaps they were able to do. But when you ask them to help you lift the patient in bed and move them over, and they're really unable to do it, and you say, do you mind if I call the neighbor man and have him come over? Not a good plan. I was told I was a misogynist because women can do anything a man can do. At my age, sometimes for me, it's very difficult to lift somebody. And one of my patients and I used to laugh because I would get down to put her shoes on and I would be struggling up her walker to get upright myself. And then we would giggle quite a bit about that because we wanted to take bets on who really was the one that needed care. I think making jokes a lot and being light about life really helps the patient. They need to laugh. They probably haven't laughed for a while, and yes, they absolutely need to laugh. I need to laugh. And I tried through my 6 months of going through this cancer that I had and knowing how it could have been far more severe, that I indeed found it important to be jovial and to make jokes of it. And it also helped the people around me. I think it helps to heal you a lot. I have a lot of anxiety, but then I always have had. And I really try and relax and tell myself I really don't need to be in charge of tomorrow or next month or next year because I only really have today. So that's important. I don't really mention this to my patients that I'm taking care of because they really have enough trouble without being lectured, and I don't think that's my place anyway. But my place is to cook them great meals, to take them to outings, if they have a chance to go to the public breakfasts that we have in our town for the age group that they're in, then take them and sit there and enjoy yourself as much as you can. They do a lot of complaining, of course. They complain about their children, their grandchildren, their husbands or wives. And it's best just to listen and nod because if you really take a side, then eventually you're going to get in trouble. So these are some of the suggestions I have for taking care of people psychologically because it's really important. I think one of the worst things that I came across was medications. People were not taking them at all. especially if you weren't there every day, if you skipped a day or two and came back and found out that all the pills were there for 2 days and they swore that they had taken them. And the other thing I ran up against most recently in the year that I took care of two clients that were in their 90s was that they would call up and cancel their doctor's appointments almost every time. So I had to call the doctor's office and say, please do not let them cancel their appointments. Call me and I will tell you if they're coming or not, or if they have good reason not to be able to come. But inevitably, when Tuesday at 8 o'clock would come and I would drive by to pick them up, they weren't ready because they had oh, we didn't tell you. Oh, you didn't know? We canceled it last week. Well, that makes it insanely difficult to call the doctor back up and work again to get them back on schedule, because nowadays it takes a very long time to get into a doctor. Sometimes they're just tired of going to five different doctors a month, and a lot of times that's what they're up against. Not that that's right or wrong, but it's difficult for anybody that's aging to have an all-day session. In our case, our doctors are generally about 50 miles away in the main town we have in the county, and a lot of our towns are real small. So you have to go a long way. You have to make it a whole day and prepare to get it done, and then take care of them. So they're exhausted by the time you get home, and so am I, of course. I think working at an older age like I do in healthcare is good for me because I really need to get out of the house and talk to other people. I find one of the more difficult things is the relatives of the patient. They're always interfering or think they know what's best for their people without asking them, which I don't like. I think they should always ask, what do you feel? What would you like to do? Find out. Maybe you have to say, no, I don't think we could do that, or we couldn't go there. We wouldn't be able to get there in time or out of the car or whatever it is that they want to do. But I think that over time, over a few months, you see them really come back to life, and it's just such a beautiful thing. As the hospice part of it is, though, they will decline eventually, and so sometimes suddenly, and you lose them, and then you have to grieve, just like you would for anyone else. So I would recommend that you try to bring joy into your own life and into everyone else's.